he is actually 2 years now.
Sure.
Yeah, what I have to do? What's the step I have to do?
Yeah, before the fever he was okay, right? Before the vaccination, he was okay.
Yeah, he was fine.
Sure. Sure, you will hear the answer, inshallah.
Okay, thank you. Thank you, Dr. Isa.
Shukran. Thank you.
Again, it's very important to know the what they call the pre-existing condition.
Yeah.
Sometimes kids, over the weekend, they get in contact with their friends.
Yeah.
And then after the weekend, they visit the clinic to get the vaccination.
Yeah.
In fact, parents should be aware that some viruses, it takes the incubation period where the moment you catch the virus, it takes 3 to 4 days to cook the virus within your body system. When you receive the vaccination, either your body will react to the vaccination itself, or react to that as you catch it. So this is the most important. I would like just to inform our viewer that make sure that he didn't came across somebody who has fever, viruses or flu-like illnesses. At the same time, you just deal with him. Temperature, control the temperature there. Just basic first aid of taking care of the temperature.
Okay, thank you. Back again to our topic in upper respiratory tract infections, red flags associated with that.
Again, the presence of a cough, we have to differentiate between different age group.
Yeah.
A cough in a 3 months and below, it's not a good thing to have to leave it.
Yeah.
A cough should be seen and examined. Kids more than 3 months to 6 months, their cough, we have to make sure there is no underlying infection, especially with the season nowadays.
Yeah.
More than a year, kids, when they have repeatedly cough, we have to make sure they are not allergic to certain foods or to certain allergens. At the same time, always I'm saying to the moms, in fact, a couple of weeks ago, I came across somebody, especially with the people now placing their kids in nurseries.
Yeah.
And those 2-3 years old, although you supervise them at home, but when they go to the nursery, they do have some supervision, but those kids, they can get some seeds or some popcorns.
Yeah.
They can choke with it.
Yeah.
And nobody knows.
Yeah.
And it will be, that kid will be coughing all night long. And the mom, she comes in and complaining about frequent coughing, and she will do a lot of shopping around to treat the cough.
Yeah.
A simple question or a simple observation, you can catch it. So a chest X-ray should be a must in each and every single kid who coughs, just to make sure that there is no history of a foreign body. And if we ask our colleague, the pediatric respirologist and who taking care of chest, they do a lot of scopes where they can pick up and get some foreign bodies. Don't be, Teresa, don't be surprised when we came across so many scopes, they get so many seeds out of their kids. In fact, popcorn can be, especially in birthdays, parties, and especially a week ago where people are going around.
Exactly.
So sometimes you get busy when the family get together and they leave the kids unattended.
Exactly. And I think this is one of the causes of people might think and label their kids as asthmatic with the foreign body.
Sure. This is exactly, we have to make sure that we don't leave small, tiny things and be handy in front of the kids. To try our best, but sometimes, in spite of whatever you try, kids can do so many things. In fact, one of the funny thing that happened, that a kid brought by his parents, and they were just having a foul smelly from his mouth. When we just examined the kid, there was nothing in his mouth. So we sent him to have an X-ray for his adenoid. And surprise, what we find? We found that the small cover of the pen itself, it was inside the nose. And that small foreign body, of course, stayed there for a while, and so many secretions were there. So we refer him to our colleague ENT, and they took it off. So sometimes just a bad smell in the kid, nobody knows, unnoticed.
Exactly.
And sometimes repeated infection in the ears, in one ear, can give you a hint that please look for a foreign body. And don't be surprised if you find a foreign body, a small tiny things being put in the kid's hand. Either the kid himself or herself put it inside their ears, or somebody, other kids were playing together and they put it inside. Yeah,
because this is the problem with the kids. They usually tend to pick up small stuff from the ground.
Sure.
And put them in their nose, mouth and ear.
Right, right.
Another hot topic also is gastroenteritis, or having a baby with diarrhea.
Right.
Okay. I think many people are complaining about that, especially with the school going and back to school nowadays. What is your advice and how to prevent such condition?
Again, number one is that to educate kids in the school that hand washing, it is the number one to prevent infection. Again, the type of food, kids nowadays either they get their foods from the school itself, or they can go to the nearby groceries and they buy it. So we have to be very, very careful with the kids. The gastroenteritis, if it is viral illnesses, something we cannot prevent it. But the gastroenteritis or the diarrhea, which comes from restaurants, and especially restaurants, kids and families get the gastroenteritis commonly during parties or during occasion. For example, if last week we were having the celebration, so many people will have to be in the restaurants and eating, so sometimes fast food will not be able to be cooked properly. So it puts people at the risk. So I think the most important is that hand washing, to be very careful in choosing our type of food. The other thing is that whenever a kid becomes sick, no school. This is the formula, simple formula, because to prevent him and to prevent the community around him, we don't want to spread the infection around.
Exactly.
And again, when the housemaid got sick, we have to let the kids to be away from the housemaid, because we don't want the infection to spread around. The third thing is that to avoid dehydration. Most of gastroenteritis are viruses. So there is no antibiotics, there is no medicine whatsoever. The treatment of gastroenteritis for any age group more than a year is that to observe, to avoid oily food, and to try yourself to drink more than to eat. Because our body and the kid's body built basically 80 to 85 is full of water. So when the kid starts to vomit or to have a loose motion, he or she will be dehydrated. So is the fluids which we have to supply for the kid to avoid dehydration.
One of the fluids that the ministry they supply is oral replacement solutions. Are they good enough to overhydrate?
In fact, we are proud in Kuwait to have one of those pioneer in treating dehydration and gastroenteritis. We have Professor Mullah, who is the founder of how he saved thousands of kids in Bangladesh by a simple just type of boiling the rice. The boiling rice, the water itself, is so much rich in all the nutrients which a body will lose it during the gastroenteritis. So whenever you have a kid or an adult has gastroenteritis, the drug of choice, if we consider it as a drug, is that you have a white rice at home, you boil it, or you can even have it as a soup, and get that water and try to drink it. It has all the nutrients which you lose it already, as well as it has some starch things which going to harden a little bit of the amount of the stool you are losing.
Sorry, but we have a question from our viewer Abdul Wahab. He is asking about how do you deal with premature babies and handicapped babies during treatment and follow-ups?
Again, you have to choose your pediatrician. You have to choose somebody whom you trust to have the follow-up. with him or with her. This is very important, because the pediatrician, it's the, I'm always saying, it's the godfather for the kid, because he will know the fine-tuning things. So the first year of life of a preterm who's between quote-unquote has some handicap issues, he needs physical therapy, he needs occupational therapy, he needs some hearing assessment, he needs eye issues. And again, most of the time, we need to sit down with the parents. We have to explain to the parents. We have to show them how to deal with such type of kids, and to give them a hope. Because if we will not have hope in our kids, there will be no use of our existence.
Exactly.
And when I say no hope in our kids, even for me as a pediatrician, I have to have a hope in my patients. If I don't have that belief, if I don't have that trust in my patient, I cannot use that belief and that trust to invest in our patients.
We are approaching the end of the show, but we need to address a very important subject before that. Nowadays, every kid has an iPad or iPhone or whatever. What's your input on that?
What I'm trying to say is that try your best. It's a message. It's a warning message. I cannot say take it or leave it. No, you have to take it. Trust me, kids nowadays, they have their own world. We came across so many kids. They have some autistic behavior, or some of them, they are so much into their only world. And when we go back in the history, either they are watching certain kids channels, which everybody knows about them, or they are into their iPads and into their iPhones or iPod. I think it's so risky to let your kid to be dependent in an iPad. It's not an excuse for a mom to feed her kid while he or she will watch the iPad. This is not the method to distract him for him to eat. If we have an association between food and an iPad, we're going to have a totally different generation. Nowadays, Dr. Isa, the iPad, even in the car, there is no communication whatsoever between the family members, all of them. Education starts from the start. When the mother, when she has her baby in her tummy, she should read the stories while as if she is talking to him or to her. When the baby comes out, those rhythms where mom will go back and book rehearse them. And this is what our olden days moms and dads were communicating with us. With the new generation and with the new era of technology, we lost the contact. We are in contact only digitally, but unfortunately, physically we are not in touch. So for a mom to leave her kid with the nanny to feed him, that nanny will feed him the food, and she will let him to watch that channel or to watch that iPad. And mom will she just just leave her brain to go somewhere else. I think it is our responsibility, being parents, to sit down and to have communication with our kids. Otherwise, our kids will not communicate with us anymore.
With your practice, doctor, do you come across many kids with delayed intellectual function due to this fact they are using iPads? Because many people are advocating that, okay, I give him an iPad, but I give him a kids application where he can enrich his knowledge and increase his intellectual level. But
I'm not saying that iPad shouldn't be at home. But it's a tool. If we're going to let the iPad in the kids of 2 years or 3 years to be in his hand or in her hands, and he will be totally away from the world of communication, one day will come that he or she will not be able to communicate with his parents. The more you sit down with your kids, the more you teach them how to speak up and how to represent themselves. It's not the iPad. I'm not saying that iPad should be not exist at home, but it's a tool to help us to overcome certain issues.
So the iPad is a good tool, if used wisely.
Right.
And could be a bad tool if used otherwise.
Sure.
And I'm sure many of our viewers, most of them, they are using that tool, either a good or bad, but we hope that they will develop into a good habit using that tool. Do you think that kids or babies from, let's say, 1 year old and upward should be spoken to as adult, or in a way that it will give them, for example, if I have a kid, I should talk to him, address him properly, because that will increase his intellectual level, or just deal with them as babies?
It's a well written and stated statement that kids, the first 2 years, like a sponge.
Yeah.
How much they gain, this much they give you back. So if we go not to speak to them and communicate with them, one day will come, they will not be able to comprehend what kind of order you're going to give it to them. I'm not saying that, again, to be away from the technology. Let's use the technology to teach us how to communicate with our own kids.
Yeah, exactly.
To be more and more physically, mentally with our kids, to understand their needs.
Yeah.
If we will not be able to understand their needs, kids will start to have their fingers to ask for things to be brought to them.
Yeah.
Instead of communicating, I need that and